Good afternoon, everyone, and thanks again for joining us for Pancare Foundation's second Living Well series webinar, which has been made possible today thanks to funding from Dry July Foundation. My name is Liz, and I'm part of the team here at Pancare Foundation, and I'll be your host today. We're thrilled that you're able to join with us, many of you from all different parts of the country. Before we go any further, in the spirit of reconciliation, Pancare would like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to the land, sea and community. We pay respect to them, their cultures and to elders past, present and emerging. If you're new to Pancare, we're a not-for-profit organisation whose sole purpose is to help people living with upper gastrointestinal cancers such as pancreatic, liver, stomach, esophageal, biliary, and to raise awareness and accelerate research for these cancers. No matter today, if you're a patient living with an upper GI cancer or you're caring for someone or perhaps you're a health professional with us today, we hope you really do find something valuable out of today's session. In addition to what you'll learn, the key message that we want you to take home today is that you're not alone. We're here to support you. No matter if you've been recently diagnosed or you're undergoing treatment or you're caring for someone and you need to hear the voice of reassurance and someone who understands, we've got a patient support team here at Pancare who would love nothing more than to support you on your journey. And we'll let you know a little bit more on how you can connect with Pancare and some of the services that we have available throughout the presentation today. To make today's session a little bit easier for you, there's a few little tips. You'll be able to follow along with the presenters on the console today, which is what's in front of you at the moment. So if any time you've got a question, whether that's a technical question, you're having trouble with the console, or perhaps you've got a question you'd like to ask one of our presenters, you'll see that there's a Q&A box where you can type that question in. And at the end of the presentation today, we'll get around to hopefully answering a lot of your questions. So let's get straight into today's webinar. If you've just been diagnosed or you're in the process of undergoing treatment at the moment, one of the challenges that you may be learning to manage is some of those side effects or the symptoms that you've been experiencing. So today we're going to take you on a guided journey of understanding what some of these symptoms are and why they occur. We'll also discuss with you some of the treatment options that may be available to you and how to plan for those treatments and some ways that you can practically manage some of the side effects to the treatments to enable you to live as well as possible. So today you'll be hearing from two of our leading upper gastrointestinal nurses who have many years of experience in oncology. So firstly, I'd like to introduce you to Kristy-Lee Jones, who joins us from the Epworth Hospital today, and she's a clinical oncology nurse facilitator. And I'd also like you to introduce you to Pancare's very own Shannon Gleeson, who is our pancreatic and upper GI specialist nurse. And hopefully many of you have already had the opportunity to speak with Shannon over the course of your journey. Both Kristy-Lee and Shannon will take you through different aspects of today's presentation. So Kristy, I'd love to hand over to you to start things off for us today.
Thank you so much, and thank you for having me today. I'm really excited to be talking to you about some of the side effects that you may be thinking is troublesome to you throughout your day, or might be a little bit scary if you're just starting treatment as well. One of my passions is empowering and enabling you, once you leave the hospital, to be able to live your fullest life at home. And that means by managing through some of the symptoms and side effects that you might be experiencing because of your treatment. So we would like to get to know you a little bit more, so it helps us tailor today for you. So before we start, let's get to know you. So we just have a little poll, which is a question to understand what is the symptoms and side effects that are most troublesome to you in your everyday life. So I want you to think about, in a day, what symptoms cause you to not be able to do the things that you love to do? What cause you to have less energy in the day? We want to know this because we know side effects are very individual to each person, and it's really important that we are understanding what troubles you so that we can manage and help you give the tools in your tool belt to move forward, going through with the treatment, complying with the treatment, and most of all, living your fullest life. So we're just getting some responses now, and it's what we would expect. and hence why we're here today to talk to you about the side effects of treatment. So about half of you who are online have said that the side effects of your treatment are affecting your daily life often. Okay, so most days these symptoms and these side effects are causing you to not live your fullest life. And proportionally, sometimes and often in that response as well, is that you might have side effects, but you can still keep on going throughout your day without too much trouble or having to stop what you're doing. So what are we going to cover today? So I want to explore some of the symptoms you may have experienced leading up to being diagnosed, giving a little bit of a light as to why you might experience those symptoms. We're going to talk about different treatments, keeping in mind that those online have different diagnoses. So every treatment option for a patient will be very individualised for multiple different reasons, and we'll go through that as well. We want to give you really tangible things to take home. We want to make sure that you have all the tools in your tool belt to ensure that if you're experiencing nausea, you can manage that, okay? And we'll talk about some of the common side effects that we experience or we see in the clinical setting for those upper GI cancers. We also want to speak to you, and Shannon will touch on this later on as well, about the supports that are available to you. So not only do we want to give you something to take away to manage your symptoms, but who else is out there to ask about these questions that you might not have felt comfortable asking previously? So I like this little analogy called the iceberg effect. So when a patient's diagnosed, often they present to their doctor after experiencing symptoms for a period of time. And the reason that this iceberg effect sort of is a great visual analogy is that often symptoms that we feel are intermittent and they gradually become more persistent and a little worse. So when we first experience symptoms, we might not think too much of it. They might be a little bit vague. We might put it down to something that is in our lifestyle. Maybe we had a curry the night before that's upset our stomach. It might be that we moved house on the weekend. We're a little bit more fatigued because of that. So often we put symptoms down to something else that might be going on in our lives. And so by the time these symptoms become a little bit more problematic and more persistent in our daily lives, that's when we present to the doctors. And it's only then that we undergo those investigations to find out a diagnosis. So I'm just going to talk you through the different types of cancers in the upper GI spectrum and what those symptoms might have been for you being diagnosed. So if we look at the pancreatic cancer cohort, for those of you who have been diagnosed with pancreatic cancer, you might have experienced some upper back pain. You might have experienced some GI, so whether that's some GI irritation, whether that's some reflux, whether that's some abdominal bloating, whether that's some issues with your bowels, being constipated or diarrhea. You might have pain as well, whether that's associated with eating or whether that's associated with other things in your daily life as well. You might also have some skin changes, so your skin might be looking a little bit yellow. And what I want to highlight here is that usually the symptoms that we experience with any type of cancer are because of the way that the tumour or the cancer is affecting a certain organ or body part, whether that's compression on nerves or taking up space like in the stomach or the abdomen, so you get associated pain. When we're thinking about the pancreas, we know that the pancreas is really important for digestion, and we know that it's really important in our blood glucose control as well. So if we think about what the pancreas actually does, it gives us understanding that when the pancreas isn't functioning that well, we might experience some of the symptoms that we just discussed. If we move on to stomach cancers, very similarly to the pancreatic cohort of patients, you might experience changes in your stools. Okay, that might be a darker stool than the normal colour that you would experience. You might have some associated nausea and vomiting. You might have blood that you note when you go to the toilet. You might also experience some weight loss and some loss of appetite. And one of the reasons that becomes apparent is because the stomach is really essential for absorption of nutrients, making sure that we're fueling our bodies with everything that we need and the energy in the day. So if the stomach isn't working to do that, we then have the ability to lose weight. And also we don't feel like eating. We might have some associated nausea, or when we do eat, it might not be digesting efficiently as well. I also want to touch on esophageal cancers. If we think about what the esophageal does, it's the food pipe. Okay, so when we're ingesting food from the mouth, the tract goes all the way down to our stomach until we excrete it in the toilet. If food isn't able to pass down because of a tumour or a mass, we might have difficulty swallowing. Our voice might be a little harsh. We might get some reflux, and we might experience some nausea. At the end of your esophagus, you have a sphincter, which is like a little valve that opens and shuts. And if that's not functioning well, we might get that heartburn type sensation as well. Now, you might not have experienced many of these symptoms, or you might have experienced lots of these symptoms leading up to your diagnosis. And some of these symptoms might have been experienced for a long period of time or a short period of time. What I want to highlight is that everyone is really different, and no two patients or people are ever the same, okay? And that goes, it goes even more so important when we're talking about treatments for the types of cancers that we're discussing today. So I like this slide because it highlights that one person who might be experiencing diarrhea might have that as a really prominent symptom that's affecting their daily life. Whereas diet change, which is written really smallly, might not be as big a symptom that is causing trouble in their daily life. I just want to acknowledge that it's really important as a nurse and as a support team here at PanCare that we are really addressing what is your concerns so that we can help you, okay? A lot of the time when we're diagnosing patients, there's so much information that we give you. There's so much overwhelmment, just the emotional side of things, let alone trying to get your head around options of treatment and what this means moving forward, because it does seem a little scary if you've not experienced someone close to you going through treatment. I want to give a little bit more light to these symptoms. And to start with, we can't do that without acknowledging what our body usually does. Our body is very, very clever, and every day I am more and more amazed at what our body does. Our normal cells differ very much to that of a cancer cell. And I use a little analogy when I'm teaching my nurses, and also when I'm describing this to patients as well, is that a normal cell is like a really lovely cracked egg into a egg ring, okay, that you're cooking. And a cancer cell or a malignant cell is a bit like a scrambled egg, okay? And I use that analogy because that sort of scrambled egg type analogy means that we don't really have nice normal growth, okay? We have chaos. And the normal cell nicely repeats growing and regenerating when it seeks it needing to be regenerated. And if it's damaged, we know that our body needs to reproduce that. For a cancer cell, it grows really chaotically, it divides really rapidly, and that's why some of the symptoms that we just spoke about become apparent. It also means that when we're going through treatment, sometimes we can't just isolate what we need to do to get rid of the cancer to just the cancer cells. And that means that sometimes the healthy cells are affected as well. In particular, the white cells, the red cells, and the platelets. And these are really three key blood cells that are made in our bone marrow, so in our spine. Our white blood cells help us fight infection. Our red blood cells help us carry oxygen and nutrients around the body. And our platelets help us to bruise when we hit our arm. So these play really key roles when we're thinking about treatments and how much time we need in between certain treatments. And also it means how we can individually be more mindful once we've started treatment as well. And so what types of treatments might you be receiving? There's a whole range, and again, it's not one size fits all. We use chemotherapy, targeted therapy, surgery, radiotherapy, combination therapy, and also alternative treatments. We use combinations of these as well. You might have had some surgery prior to receiving chemotherapy. You might receive some chemotherapy before you receive surgery. And you might have some radiotherapy either side of surgery and chemotherapy as well. And now this is a really important choice to make when you're first diagnosed, and it's an overwhelming choice because you're entrusting health professionals to make the right decisions for you. But it's really important as individuals, we're empowered to make the right decisions and have these discussions with our loved ones and really weigh up what is the best choice for you and what's really important to you. I know I'm a runner, so if I was having surgery, I would really want to make sure that I can still continue to run every day because that's what makes me happy and fills my cup, okay? So these are the things that we need to start giving thought to is, yes, we're going through a really scary time at the moment, but we also want to stay as true as to ourselves as we possibly can throughout this journey as well. So we've got another little question before we get into some of the side effects of the treatment. And that question is, which of the following side effects most concern you in your daily life? Infection, fatigue, peripheral neuropathy, nausea, mucositis, difficulty swallowing. So have a little bit of a think about, there's some more, abdominal discomfort, bowel habits, or jaundice, so that's the yellow skin. It's really important to sort of stop and reflect as well. I don't think we stop and reflect in our days enough. We live such busy lives. But if we were to stop and think, what really troubles me in a day? What really would I like to manage better? What would give me the ability to live my best life whilst going through something pretty yucky? Now the polls are coming through quite nicely, and there's quite a range, which is also something that I would expect as well. So what I'm seeing on the screen is that fatigue is really big for half of those that have submitted answers. And that's something that we're going to be speaking about quite in depth as well. Peripheral neuropathy is definitely something that we're going to be speaking about. Abdominal discomfort and bowel habits. And this is really nice to see because it's everything that we have put together to talk to you about today. But it also helps me gauge and tailor what to focus on as we move through as well. So let's get started. So infection. Infection is one of the side effects of treatment, whether you have surgery, radiotherapy, chemotherapy, that is really pivotal to touch on. And this is usually how I start most of my educations with patients as well, because it's really fundamental to making sure that we stay out of hospital, that we stay at home with our loved ones enjoying our lives to the fullest. And so why do we potentially have the risk of infection, when you're going through your treatments? That's because, as I mentioned before, unfortunately, a lot of the treatments that we give are systemic. So what that means is that it affects the healthy cells as well as the not so healthy cells, so the cancer cells. And what I want to highlight is that you don't have to wrap yourself up in bubble wrap at all. You can still hug your loved ones. You can still sleep in the same bed as your loved ones. You can still take your pooch for a walk. It's just about living mindfully. And what I mean by that is that you are adapting your normal everyday activities like eating, like your hygiene, and just creating a bit more awareness about what you're actually doing. So if you take, for instance, brushing your teeth, if you usually floss your teeth, continue flossing your teeth. But if you've never flossed before and you're thinking, oh, I need to make sure that my oral hygiene is up to scratch, it's not actually that wise, because we don't want to damage the gums that aren't used to that flossing technique. So what we want to be really mindful of is any potential source of infection. So that might be going out to do some gardening, and if you don't usually wear gloves, you're wearing gardening gloves. It means if you don't usually floss, you don't floss. It means that if you are getting up in the middle of the night and you accidentally stub your toe and it's bleeding, that you're addressing that really quickly, okay? Cleaning it up so that there's no chance that any bugs have the opportunity to grow there. With food hygiene, what I mean by that is making sure that you avoid those raw foods, okay? So if poached eggs is something that you really love, maybe it's that you move to hard-boiled eggs so that the egg is actually fully cooked and there's no potential food bacteria as well. It's also really important with leftovers. I know in a new diagnosis, often one of the things that family and friends can do is bring over lots of food and lots of leftovers, but just making sure that when you reheat those, beautiful gestures of gifts in regards to food, that you're reheating those adequately as well. Not leaving, the chicken out on the bench to defrost, putting it in the fridge to defrost, those sorts of things as well. Luckily, in the land of COVID in 2020, we've all become really amazing at our hand hygiene. So keeping hand sanitizer really close by in the car, making sure that you are using that before driving, before getting out, before eating as well. The next thing, which 50% of you mentioned was a really troublesome side effect of treatment that you're experiencing, was fatigue. And fatigue is, if only there was a pill to make fatigue less of a problem, I think whoever would invent that would be very rich. But some of the reasons that fatigue might happen is because the treatments are affecting our red blood cells, and our red blood cells might be then depleted. And if our red blood cells are depleted, it might mean that we don't have as much oxygen to nourish our body, okay? So it's really important to try and keep a bit of a diary about why you might be feeling fatigued in certain parts of the day and what else are you feeling at that time. So if you're feeling short of breath and you're fatigued, that's something really important to make sure that you let your healthcare team know about, okay? Because it might be that your red blood cells are low and, do you need a potential transfusion or a blood test to check those levels? Going through treatment of any kind, it is really important to also make sure that we're eating enough food and a balanced diet as well, because our metabolic needs go skyrocketing, more so than an everyday person that is walking around as well. So eating a really balanced diet is really important. I can't stress enough exercise as well. You know your body better than anyone else. So sometimes you need to exert a little energy to get a little energy. Obviously, if you haven't exercised much before, you don't want to be going out and running a marathon. But if your usual, 3-kilometre walk around the block is normal for you, then continue doing that. Making sure that you have rest throughout the day so that you're having, potentially if you need, 20 to 30 minute naps rather than big long periods of rest, so that your body is able to regenerate some of that energy as the day goes on. I find keeping a journal for patients is something really great to recommend, because it allows us to give meaning to what we're actually feeling and sort of join the dots if anything else is going on as well, whether that be shortness of breath. And I don't want to move on without saying that going through a cancer diagnosis is incredibly emotional, and often it's really emotional for the ones around us, and often the patients feel quite a burden to be strong and not worry our loved ones as well, knowing that our loved ones also need support. So it's a really tricky time. I think the number one thing with fatigue is to openly speak about it, okay? Make sure that you're telling those visitors that are coming around no if you don't feel like a visitor, okay? Or allocating times in the day where you have more energy to do the things that you want, whether that's going for a coffee with a friend as well, but knowing that you can say no at the same time is really important. And I want to empower you to put yourselves first and make sure that you're listening to your body. I think too often we just keep on keeping on, and it's really important to slow down and reflect. What can we remove from our day to fill up our cup? Peripheral neuropathy was one of the side effects that also ranked quite highly for the poll, and that can be because of a number of things. When we're thinking about chemotherapy, we're thinking about certain drugs in regimes that affect the peripherals, okay? And that's your toes and your fingers. And we often describe this as a glove stocking sort of symptom, whereas you lose sensation first in your fingers and your toes. Sometimes this can also be nerve damage from surgery, and this can be in the abdominal region as well. So it can really be quite troublesome for our bowels. And so if you're experiencing constipation and diarrhea, that's also something to be mindful of in regards to neuropathy. I think when we think about peripheral neuropathy, we do definitely tend to think about our toes and our fingers more so. But just know and have an awareness that it can mimic in other parts of our body as well. Coming into summer, we're all going to be wearing less closed shoes and more open shoes. And I just want to reiterate that foot safety and appropriate footwear is really, really important. You don't want to be in a situation where you don't feel an injury if you stub your toe or you accidentally step on a stone. So having a think about what footwear you might wear outside, but also inside as well. One of the tips I always like to give patients is in the morning just mindfully getting up. So that's popping your feet on the ground and having a bit of a check-in with yourself. Can you feel and wiggle all your toes? Does that feel normal? Can you feel your fingers? Does that feel normal? Okay, yep, that feels normal. I'm right to get up. It also gives your body an ability to readjust. So when we're laying, our blood pressure falls quite a little bit lower. So it's also really important that just in the hospital, so there's an announcement over. It also allows us as patients to make sure that we're going slow and really checking in and listening to our bodies. Okay, having slippers that are enclosed around the foot as opposed to just sliding slippers is really a great way to make sure that you're protecting your feet, making sure that they're nice and warm as well, because in sensation loss often you don't feel the cold as well. It's also about being mindful in the kitchen, for instance, when you're using utensils, making sure that you've got a really good grip on those, those sharp knives before you cut that loaf of bread. It's about starting with all your dishes outside the sink rather than in the sink, so you know what's in there and that you're not going to potentially cause an injury that you might not feel, but also another potential source of infection that might cause some complications. Keeping your environment really uncluttered is really important, and using your family to, let's have a bit of a clean up day. Let's bond and make sure that we're in an environment where you're not going to bump into things or potentially trip. Because sometimes when we're going through these treatments, our heads become a little bit more foggy, and so our innate responses aren't as prompt sometimes. It's really important to have these conversations with the medical team that is treating you, because sometimes the longer we leave these symptoms, the more permanent they are potentially going to become. And I think sometimes patients don't want to escalate this to their healthcare team for fear of wanting to or not wanting to, or their treatment being postponed or delayed or not going on with the treatment. And there's a lot of things from a nursing perspective that we can do to make sure that you can still continue on with your treatment as well. So it's really important not to be scared, but have an open conversation and really make sure that you're telling a full story, and even the littlest of symptoms might be really significant to your team. So nausea is also one of those symptoms that most people going through upper GI treatment experience. And some tips around that is knowing your normal weight, using your medication appropriately, and if you don't know what your medications are used for, getting and seeking a medication profile whilst you're still in a hospital setting, or reaching out to your healthcare team or your doctor's offices, or if there's a support nurse as well, to make sure that you're really understanding what medication you're on and when to take those. So a lot of the anti-nausea medications are of benefit to taking that half an hour prior to food. With nausea, sometimes it can be precipitated by smell. So having cold meals or meals that don't have odour, sometimes that's really helpful as well. And when we're nauseated, we don't usually feel like eating. So having really hydrating, nourishing fluids is really important. Whether that's water or ginger ale can sometimes be quite settling for the tummy as well. Mucositis. So mucositis, again, the cells in our mucosa, in our mouth, are rapidly dividing. So often they're affected quite frequently by the treatments that we give. So some tips to getting around that is, again, making sure that we're really looking after our mouth. So using really gentle products, really gentle toothpaste that don't have too many harsh ingredients in there. Making sure that we're mouthwashing with not harsh Listerines, but rather a quarter of a teaspoon of bicarb soda and a quarter teaspoon of salt with some warm water. Sometimes we need to also change up our flavours. If things are too spicy, having a really plain plate of food is sometimes a little bit more beneficial, and it's not going to irritate the lining of your mouth as well. If your mouth becomes a little bit dry, it's important to promote those salivary glands. So sometimes sucking on sweets, having some chewy, or getting a fizzy drink will enable the tongue to coat a little bit more freely and your saliva to be reproduced. Difficulty swallowing. This wasn't a common side effect that came up in the polls, but it's really, really important to escalate this to your healthcare team as well. So sometimes it can be just as simple as changing the texture of your diet, but it's really important that we are making sure that you are getting enough nutritional support, because we know that, as we mentioned before, our metabolic needs increase when we're going through treatment. So that might be increasing some protein drinks and getting a dietitian involved as well. Taking smaller sips or smaller foods, smaller mouthfuls of food is also really helpful, and making sure that we're really having a sip of water and then gulping, so we're really mimicking that sphincter closure as well. Abdominal discomfort and bowel habits. I'm going to speak together about that. So bowel habits, often the treatments that we give can cause constipation, and it can also cause diarrhea as well. And now we know that those online that have pancreatic cancer, some of you might have experienced going through surgery where part or the whole of the pancreas has been removed, and the pancreas has enzymes that help with digestion. So if the pancreas or parts of the pancreas are removed, often we don't have those enzymes that help us digest the food. So therefore we're not absorbing what we need to, and that can lead into that fatigue and that nausea as well. So one of the ways to help with bowel habits is by the use of Creon. Now, Creon has to be medically prescribed, so it's something that you need to speak to your doctors about. But it will help and mimic the enzymes that the pancreas is no longer producing for you. So some key things around taking Creon is taking it with food, or taking a really big glass of water so that it is digested. Keeping in mind that the doses differ for snacks as it does for a bigger meal, okay? And we can talk about that. I'm sure there will be lots of questions to come up in regards to Creon. It's also really important to know that it only lasts for 20 minutes. So if you're having a big long Christmas lunch, which hopefully we can all have, that we might need to take some more Creon throughout that meal as well. Some other things to be mindful of with our abdominal discomfort is ensuring that we're actually giving meaning to what that actually feels like for us. So is it bloating? Is that associated with something that we've eaten? What is our bowel habits in the toilet looking like, smelling like? Has that changed? So really understanding what is your normal and what is happening now, and is there something that we can join the dots for in regards to is there something really significant that we need to address from a medical team, or is it that we've given you chemotherapy that makes you go to the toilet and have diarrhea and have some cramps? Maybe safely using heat packs might be of benefit to you in those particular times as well. Now, I'm not going to talk too much about jauntiness. It is when our skin turns a little tint of yellow because of blocked biliary ducts. But I do think it's really important to touch on the physical side of going through treatment, and that we as patients will feel sick, but often when we look sick as well, that's just as troublesome for us. So body image is a really big thing for patients going through their cancer journey. So things like looking after your skin, wearing makeup, if you do have that itch or that itch associated with that yellow tinted skin, using antihistamines if it's safe to do so and prescribed by your doctor, but making sure that you're really feeling comfortable in your own skin as well. And that's something that the team at Care can support you with in tips moving forward for body image as well. So we have another a poll just to lead into Shannon speaking about some further supports that we do have for you ongoing throughout your treatment. And so with the side effects that you've said that you're experiencing now, how well do you feel that you are being supported in managing these? And that can encompass, your healthcare team. It can encompass, family, but do you think that you need more support? Great. That's actually really promising. So everyone feels quite well supported, if not, maybe needing a little bit more support. And I guess that's why we do sessions like today, is to make sure that we can really understand how we can support you best. So most of those who have polled have said that they feel well supported or somewhat supported. But I think there's always more that we can do, and it's not until we know what support is out there that we're able to grab onto those. So I'm going to hand over to Shan now to speak more about those supports.
Thanks, Kristy-Lee, and it's an honour to be here in front of everyone today. So I just wanted to initially touch on what we at Pancare actually do in our Pan support team. So many of you may have already met us over the phone, and we understand that talking about cancer can be tough, and our patient and carer support team can offer a sympathetic and caring ear, and we're ready to talk about whatever matters to you while providing expert cancer information and help you navigate that journey. If you're worried about side effects and the impact on your quality of life as you undergo treatment, or maybe you just want to touch base with someone who understands what you're going through, the patient and carer support team are here. We can offer guidance and help you get the right information and support in your area. So meeting every fortnight is our online patient and carer support meetings. And this is an opportunity to discuss with your peers about what's happening. And it's a great opportunity for you all to gain insights from others who may have or have had the same side effects and can impart their knowledge about what worked for them. So I'd encourage you all to try and join, and maybe you'll have something that might help another patient as well. So sometimes people are a little bit apprehensive about joining, and we do encourage people to just get on there, have a bit of a listen, and you never know if you're going to help someone else as well. So you might get something from someone else, but you might give something to someone else as well, which is really, really important. And that's what's so great about this group. So the sharing and the understanding within the group is wonderful. So we also have a variety of educational we also have our Pancare website. So we are very lucky that we have a very good website at pancare.org, and we also have pansupport.org. And we feel that it's really important that if you aren't in a position to get in contact with us here at Pancare via the phone, with your healthcare team, with your oncologist, your GP, you or your family and friends can also navigate these websites and somehow, get some guidance on how we can support you through this roller coaster. So this is Pan Support. Pan Support was made by a lot of patient input, a lot of carer input, and it's very relevant. So go on and have a bit of a look. It's wonderful to kind of go through. The other thing I just wanted to touch on is we do have some educational materials. So we have a variety of informative fact sheets that can be sent to you or downloaded, and these can help you navigate side effects. And we just wanted to reinforce that we hope that you gain education and insight, and you feel empowered to take an active role in your treatment and your cancer. So I just, touch on what Kristy-Lee said, speaking up about your side effects, making sure that you're having the right dose of chemotherapy, you're in the right time frame. Speaking and telling your doctors and care team about your side effects does not necessarily mean that treatment ends. It just means we find a safe equilibrium for you to continue. So we would encourage you to get a simple notepad, write down the kind of things you're experiencing and detail your experience. And I understand that it is quite hard to talk about side effects with your oncologist, because you might be having just a quick chat prior to you going into chemo. But it's really important that you allow at least 5 minutes to touch on them, because we think it's really, really important. So we also are doing our Living Well webinar series, and as you can see from today, we bring those that are experts in the industry and present it in a way that our patients and carers can understand. So it's really important that you are well supported, well educated, and enabled. And thank you for listening. I'm going to throw back to Liz now, who's been busy collating your questions in the background. So thanks, Liz.
No worries, Shan. Well, thanks very much to both Kristy-Lee and Shannon at the moment. And look, we've had quite a few questions coming through on the chat. It's not too late. If you do have a question that you'd like to speak with Shannon or Kristy-Lee about, please use the chat function and we'll try and get it answered. We have had a few coming through on Creon, which always seems to be a really relevant topic of discussion. And someone has a question on if there is a limit to how much Creon you can have in a day. Would either Shannon or Kristy-Lee just like to talk around Creon dosage and how you can talk to your healthcare team more about that?
Yeah, definitely. So I think the really important thing with Creon is to understand that the dosing is going to be different for every patient. So it's really about making sure that when you're taking your Creon, we're reflecting on, is it doing what it's supposed to do? So the usual regimen or recommendation for Creon is 1 tablet, and then that's the 10,000 international units, and then that is to be taken with snacks. And then when you're taking a main meal, you can take 2 of the 25,000 international units of the Creon capsules. So that would be the guide. And again, that might be different for everyone. So some patients might be snacking more frequently throughout the day, and some patients might be having a longer meal. But it's really important to know the prescribed dose that the doctor gives you, to report how that is benefiting you. So is your stools floating? Are they a light colour? Really acknowledging what the effect of Creon does, and then making sure that we have that discussion with the healthcare team to increase or decrease should we need to. So it's very patient dependent.
That's good. So the recommendation is, please speak to your healthcare professional team if you do need to adjust any of your Creon dosage as well. We've had a few additional questions come through managing the pain and symptoms associated with peripheral neuropathy. Shannon, this might be a really great question for you to answer. There's 2 questions that have come through from that. The first one is acupuncture something that's going to help with the pain associated? And additionally, are there any other medications or creams or vitamins that might be able to assist in peripheral neuropathy?
Yeah, look, it's something that comes off quite often, and the best answer is that as long as you're discussing any alternative treatments with your care team, then it's not wrong to seek out alternatives. Okay, so acupuncture could help you. There are some lovely hand creams and that you could possibly use, but the main thing that we tell our patients is that having that loss of sensation in those nerves, it will take many months to regenerate. So once you've lost those nerves, it's not going to come back essentially overnight, okay? And the other thing you can do is exercise the area. So rolling a spiky ball or a tennis ball around in your hands and also on your feet on the floor is a good way of getting blood flowing to that area, getting some oxygenation and getting those nerve cells to regenerate as well. So, there are alternatives out there. I think as long as you're discussing these with your care team, as long as you're doing it in a safe manner, then we support you.
No worries. One of the other questions that we've had come through from a participant is around fatigue, or actually not being able to sleep, and when they're having chemotherapy, having a steroid dosage as well, and then that's causing associated problems with just not being able to get to sleep. Sometimes they were feeling like they were very sleepy, and other times now they're just laying awake there all night. So this is probably something that you might hear often from patients as well. Kristy-Lee, is this something that you might be able to offer any support or advice on?
Yeah, definitely. It is the dreadful steroid side effects, unfortunately, and even the littlest of doses can be really sensitive to patients. So I would definitely encourage you to speak to your healthcare team. Sometimes, depending on the need and use of the steroids like dexamethasone for your particular chemotherapies, it might be that there's an alternate to use if we're using that for a pre-medication prevention of nausea, for instance. So we might be able to substitute it out potentially. I think really developing great sleep hygiene, it seems really basic and sometimes a bit fluffy, but really making sure that your body senses the ability that it needs to sleep at night time as well. So switching off all your devices, really calming your body so that you naturally fall into asleep despite having all those extra medications on board as well. I know sometimes the steroids that we take on multiple days after the chemotherapy, so just taking them really as early as possible in the day so it's less likely to be lingering around in your body in the later hours of the day is sometimes really great as well. And I guess speaking to your team again about alternatives of what can help you sleep. There are some medications, and I know not everyone wants to take medications, but it's definitely a discussion to have as well, because it does impact quality of life and really talks to that fatigue, that side effect as well.
Absolutely. Thanks for that, Kristy. Sorry, Shannon, did you have another question, answer to that one as well?
Yeah, I just wanted to also add in the importance of exercise. So, getting out there doing as much as you can, even if it is just a walk around the block.
Fantastic. One of the other aspects you touched on earlier as well was around mouth soreness and dryness of mouth, which seems to be quite a common side effect from having chemotherapy. One of the questions that's come through, is there any particular type of toothpaste or mouthwashes or ointments that you can potentially use that can help this symptom? Shannon, you might be able to answer this one best for us.
Yeah, so there are a number of medicational stuff that you can get from the chemist, and mouth drops, things that make you produce more saliva in your mouth. It's difficult to not have foods that you enjoy sometimes, but steering away from more acidic foods, acidic-based foods that can sometimes also hurt the ulcerations and the soreness. But just know that it is kind of normal, and the mouth does regenerate quite quickly. So it doesn't necessarily mean you have to put up with it, but it does mean that you just tell your care team that you've got it. Try and use those mouth rinses as much as you can. So there's mouth rinses you do, steering away from alcohol-based mouthwashes and more the Peter Mac mouthwash or some of those agents to help you actually have some increase in your saliva.
No, fantastic. Probably another question I've got for you then, Shannon, that's come through is also how Pancare might be able to help work with the patient's care team as well. Is there any information that we're able to provide a patient's care team on additional services or information that might help that patient?
Yeah, so I think it's really important that we do a comprehensive assessment on the patient, where they're at in their journey. So are they at a diagnosis stage? Are they at the pre-treatment or treatment stage? So wherever you fall, you're going to have different needs, and just understanding what those current needs are, and also touching on how well your team is communicating. So it's really important to understand whether or not your GP has the test results from your oncology team. They get the CT results, the blood results, because a lot of the time you may need to just be going to your GP to be sorting out little things. And it's really nice to know that the whole team works together. And we can provide you with some details as to how you can do that, how you can get everyone on the same page when it feels like there's a bit of disconnect. Okay, so we can talk you through that, because that's really, really important, and it's a really good point that someone's made. Acknowledging that there may be some communication issues and just working with the team to sort them out is really key to kind of understanding who to go to for help, who can provide the right help. And if all else fails, you can always give us a call and we can kind of direct you into who is the most appropriate person to speak to about anything.
Well, that's fantastic. Probably only got time for one last question that's just come through the chat, and one of our lovely listeners on the call today has liver cancer, and so they wanted to know if a lot of the information that you've spoken to today, Kristy-Lee, at the start would also apply to liver cancer too.
Yeah, absolutely. So I think when we're thinking about any cancer within that abdominal region, a lot of the symptoms leading up to a diagnosis are similar because of compression within the abdomen. So you might get that pain, that nausea, vomiting, that loss of weight as well. And often, it's something I didn't mention, was that when we're going through treatment, these symptoms can be heightened in the first instance. So, a lot of the time, the nausea, the vomiting, the bloating, the abdominal discomfort, these are very common. One of the things for liver cancer in particular is that the jaundice, which we didn't speak too much about at the end, that might become a little bit more of a problem. So making sure that if that is something that you notice, whether the whites of your eyes or your skin becomes a little bit tinted with a yellow colour, that you're seeking advice from your medical team about further investigations or how to best manage that as well. But all of what we've discussed today is very relevant for that diagnosis as well.
Well, that's great. Look, thank you both again to Kristy-Lee and Shannon today for joining us. It's been fantastic understanding more about these symptoms and some ways that we can manage these. So I'd like to thank you both. Before we do wrap up today's session, I do want to let you know, as Shannon has mentioned during the course of her presentation, if that you do need any support on your journey living with an upper GI cancer, then we're here for you. Love to introduce you to how you can connect with our team. So obviously you had the opportunity to meet Shannon today, who is our upper GI cancer nurse, and Shannon can help you understand that diagnosis better, provide you with information about your treatment or the side effects or any surgical procedures that you might be having to do. Sonia is also our patient support manager, who some of you may have met at Pancare before, and she is really that constant voice of reassurance for you along that journey. She can help you with a range of practical and emotional ways, such as connecting with others, finding links to other healthcare professionals and wellness services in your area, as well as any allied health professionals that can help you. We've also had Mira Patel, who's just joined us at the Pancare team, and she's joined us in the role of a counsellor, which is a really, really valuable support service that we've just introduced. And she can help you through a one-on-one private video counselling session to talk maybe about the impact of your diagnosis. Perhaps there's things on your mind that are worrying you, if potentially you're a carer as well and you're wanting to talk to someone who understands as well about what that journey's been like for you. Mira's available for 45-minute sessions, and we're making those available free of charge to our Pancare community. So both Shannon, Mira and Sonia are all available via a telehealth appointment, and you can book those calls directly on our website or by emailing support@pancare.org.au. As Shannon said, some other ways that you might like to find some support on your journey is through our monthly patient support group. It's online, so it doesn't matter where you are or what state you're in. You can join from the comfort of your own home, and it just allows you that opportunity to meet with others who are living with an upper GI cancer. Sometimes we do have experts that come into those sessions as well to talk about various topics like diet, nutrition, or health and wellness and exercise, but otherwise they're a true peer-to-peer group where you can just have a friendly chat with each other and help each other troubleshoot. Our next support group's actually coming up next week, and we'd certainly love to see you there, so you can reach out to us if you'd like to join. We've also got our next webinar coming up in February, which we'd certainly love you to be involved in. The details for that will be coming out shortly, but it is all around exercise and keeping active with an upper GI cancer. And we'll have Dale, who is an accredited exercise physiologist as well, sharing that session, which hopefully will be really beneficial for you. Look, that's all we've got time for today. Again, thank you so much for joining us. We'd certainly love to hear your thoughts on today's session. It is one way that we can continue to improve the information and the services that we have available for you. So after this webinar ends, you'll be provided with a short survey on your screen. We'd love you to take a few moments, if you can, just to provide that detailed feedback with it to us, so we can continue to improve these sessions and potentially also help them benefit others who are joining at a later date too. You can find more about Pancare at pancare.org.au and get in touch with our support team there. You're certainly not alone. We're here to support you. If you need to bring us for a chat, we're always here. So look, from all of us at Pancare, take care, and we'll see you again next time. Thank you.